welcome to a healthy dialogue on healthcare. What we're trying to accomplish here tonight is to open up the word dialogue. And that's just that. What is a dialogue? It's different than a debate. It's different than contestment. But we're trying to learn a little bit about this healthcare bill that's so critical in our near future. And thank you to the sponsors of this program, the Muskegon Ethics Institute here at the college. Really appreciate putting on shows like this and programs like this. The Progressive Women's Alliance, thank you for becoming involved in this. But really thanks to all the citizens here in Muskegon, West Michigan, and our entire country that is taking time out during the last 6 months to learn about these critical issues. Healthcare is not new in this country. Attempts at healthcare is not new. As you can see, in the last 74 years, we've had 6 or 7 different attempts, starting with the Roosevelt administration, the Truman administration, on through Presidents Johnson and Clinton. And it's met some varied success, some varied setbacks. But what's taking place today in Congress is not new. We do have publicly funded health care. This is also not new. And that's part of our learning curve here, is realizing that this is not an entirely new concept, but a concept that's been with us for a while. We've got Medicare. We've got Medicaid. Our Veterans Administration. All of these are publicly funded health care systems. So what's being put forth in Congress right now, it's different, but it's not 100% new. I would like to introduce first, before we get to our panelists, I'd like to introduce Mary Duncan. Mary was instrumental in really creating this group and this forum. So, Mary, please come up and tell us how this happened. If you'd help me welcome Mary to the podium.
Well, the idea for our forum tonight really grew out of a conversation I had with a couple friends this past summer. None of us with expertise in healthcare, and each of us with health care insurance. We were confused by the multitude of information circulating about healthcare reform. And remembering the effectiveness of grassroots effort, we set out to create a venue for an instructive and thoughtful dialogue between professionals who deal with healthcare on a daily basis and an audience who wants to know more about the issues. Initially, this was all rather academic and theoretical. Then a month ago, it became personal. I have a 22-year-old son who is currently not a full-time student and so no longer qualifies for our family's group policy. He's 5'6", 190 pounds, has always been extremely muscular and fit, and was recently deemed in excellent health at a recent physical. He also happens to be underemployed. He has a part-time job and an unpaid internship. So, in order to be helpful parents and responsible citizens, we applied for an individual policy for him. It would cost $85 a month and would have a $4,000 deductible. But much to our surprise, he was denied coverage. So, 2 reasons were given. He had a pre-existing condition of teenage acne, and his weight. The chart used by the insurance company apparently didn't accommodate his stocky build. My guess is that if he really wants to be covered by health insurance, he'll have to secure a much higher rate, higher deductible policy to satisfy what is perceived as risk factors. Suddenly, I had a new ear for the many similar stories I've heard, most of them much more serious than our son's, where the pre-existing condition is life-threatening and costly to treat, where medical expenses lead to bankruptcy, and where patients die because they can't afford treatment. In a recent Newsweek article, Fareed Zakaria pointed out that there are 2 great healthcare crises in America, one involving coverage and the other cost. We're going to hear our panelists address these 2 crises as they speak on issues of the practice of medicine, holistic health, ethics, and economics. We invite your questions and input this evening, and then urge you to stay involved in the political process. Make sure your representatives in Washington know how you feel.